Hello everyone, I'm Dr. Monica. Today's video is about gingival crevicular fluid. So let's begin with the topic. Let's first understand the basics about GCF. GCF is a circular fluid, meaning that it is present in the gingival sulcus. It plays a key role in oral defense mechanisms and it can be used as a diagnostic tool because GCF have inflammatory mediators, host-derived enzymes and the inhibitors. Also, GCF comprises of tissue breakdown products. Analysis of GCF can be done in health and disease because of its simplicity and also as it can be obtained with non-invasive methods. So let's briefly understand the formation of GCF. So whenever there is tooth injury or bacterial load on the tooth surface, there will be alteration in the microcirculation. Initially, there will be vessel contraction followed by vascular dilation with increased blood flow. Then the venules will be congested followed by arteriolar vasodilatation which will lead to increased vascular permeability and outpouring of the plasma proteins and fluids leading to exudation of these proteins and fluids into the gingival crevice which leads to the formation of gingival crevicular fluid. So coming to the composition of GCF, it mainly comprises of microbial plaque which consists of endotoxins like LPS, enzymes like acid phosphatase, alkaline phosphatase, metabolic end products like prostaglandin-like product, trypsin-like enzymes. Then comes the host cells which consist of leukocytic enzymes, lactoferrin, lysozyme, myeloperoxidase. Then we have damaged host tissues which comprises of collagen, proteoglycans and matrix protein. And next comes the host factors which plays a key role in the immune response which consist of immunoglobulins, complement factors, eicosanoids and cytokines. So coming to the methods of GCF collection, GCF can be collected by various methods. The first one is by using absorbing paper strip. It can be placed within the sulcus, which is intracellular method, or we can use extracellular method, that is placing it at its entrance. So the next method is by using pre-weight twisted threads. So these threads, they are placed in the gingival crevice around the tooth and the amount of fluid collected it is estimated by weighing the sample thread. Next we have is the use of micropipettes for GCF collection. For this, firstly, there should be isolation and drying of the gingival site where GCF needs to be collected. Then the capillary tube of known internal diameter, it is inserted into the entrance of the gingival crevice and GCF gets collected by capillary action. Since the internal diameter is already known, this is considered to be an ideal technique for GCF collection. But there are few limitations associated with this. Firstly, it is difficult to collect an adequate volume of GCF in a short period atraumatically. Secondly, it is difficult to remove the complete sample from the capillary tube. The last method used for GCF collection is intracavicular washing. For this, we can either use an appliance that consists of a hard acrylic plate covering the maxilla with soft borders and a groove which follows gingival margins, and it is connected to 4 collection tubes. The next one is the use of 2 injection needles that have been fitted one within the other. The inside needle is at the bottom of the pocket and the outside needle, it is at the gingival margin which is used to collect the GCF. The amount of GCF collected on a paper strip can be evaluated in a variety of ways. The first method is by using ninhydrin stain. In this, the wetted area can be made more visible by staining with the stain, and then it is measured on an enlarged photograph or by using a magnifying glass or by using a microscope. The second method is by using periodontal, which is an electronic method to measure the collected fluid on a blotter or a perio paper. The only limitation with periodontal use is that it is unable to measure volumes of GCF greater than 1 microliter. So there are various problems associated with GCF collection. First being contamination with blood, saliva or plaque. Second one is small sample size collected. Third one is long sampling time. It results in protein concentrations which affect the desired result. Fourth one being volume determination. The evaporation of GCF makes it more difficult to record its accurate volume. Fifth one is different manufacturers, they are going to produce different quality of paper strips which also alter the accurate volume determination. So coming to the clinical significance of GCF, GCF is an inflammatory exudate. It is present in clinically normal sulci, meaning that the clinically normal sulci at microscopic level also exhibits inflammation. The amount of GCF is greater when inflammation is present, and it can sometimes be proportional to the severity of inflammation. GCF production, it is not increased by trauma from occlusion. So there are various factors which increase GCF production. First being circadian periodicity. GCF production is increased between 6 a.m. to 10 p.m. and thereafter it decreases. Mechanical stimulation and chewing of coarse food and vigorous gingival brushing stimulates the flow of GCF. Female sex hormones, ovulation, pregnancy, use of hormonal contraceptives also lead to increase in GCF flow. Use of smoking and prosthetic appliances also increase GCF production. Studies have shown that GCF production is increased during healing period after periodontal surgery. Drugs like tetracycline and metronidazole, which are found in GCF, can be used to treat periodontal disease. Also, glucose concentration in GCF is about 3 to 4 times greater than that in serum. The total protein content of GCF is much less than that of serum. If you have liked the video, please like and subscribe.